What's going on, guys? Dr. Andrew Fix back for another episode here on the Code. Thank you so much for joining me. Really appreciate your time, however you're tuning in. And today's a content batching day. So if you just listened or watched a different episode and I'm wearing the same shirt, same hat, that's because I am. We're recording these episodes a few minutes apart, and that's what all podcasters do. In case you didn't know that, or they change clothes in between one episode to the next, and it's kind of funny just to make it look like they're doing something different. But we're coming back for another one of these shorter solo episodes today. And we're going to get up on our soapbox, my soapbox, a bit today. And I want to give a shout out to our friends at ICE, the Institute of Clinical Excellence. I'm going through one of their continuing education courses right now. Jeff Moore, Alan, and the team over there are doing an awesome job in the field of physical therapy from a Con Ed standpoint, and just consolidating a lot of the research out there, putting it to practical, applicable terms, and building some courses around that to change the way that our profession practices. And today we're going to be talking about back pain because unfortunately it is easily, like without a doubt, the number one thing, the number one chief complaint that people come walking into our office or any other outpatient physical therapy office with is back pain, right? Specifically lower back, but it could be anywhere in the back. It's the number one thing that we treat. And unfortunately, it's also one of the number one things that primary care providers and urgent care offices treat. And that's not what they need to be doing. That's not their job, right? The primary care providers, physicians, they didn't go to school to learn to be experts in treating back pain. They didn't go to school when they're the providers that are in urgent care facilities to be addressing lower back pain, right? They're there for just a step down from the emergency room. Emergency rooms aren't for back pain, right? And I want to share some staggering statistics with you guys on this conversation because I think it affects so many people. There are some studies out there. The statistics show that 88% of Americans will deal with an episode, at least one, of lower back pain in their life that will impair their function, right? It will reduce the amount of function that you have in your body and the activities that you are able to do. And the unfortunate reality about that is, most of the time people's back pain is going to get better transiently, meaning like we just give it some time, we continue to try and do things and be active, and our back pain is going to resolve even without us doing significant treatment for it. But what tends to happen, like a staircase, is we see people's activity level continue to decline, and then it plateaus, and then they have back pain again, and then it declines some more, and then it plateaus. And over the course of their life, we see their activity level continue to step down in a staircase kind of fashion, and people are gradually doing less and less and less activity over the course of their life. And unfortunately, that makes it easier for us to have the next episode of back pain. That makes it less enjoyable. We're doing less activities, whether that's with our kids or with our friends and our family, just for our own health and well-being. And things just tend to decline, right? As we do less, we hurt more, and that's not good for anybody. With back pain being so common, like we said, 88% of Americans dealing with back pain in their life, it is the number one cause of work-related disability and missed days of work. In the United States, 264 million days of work missed per year, secondary to back pain, right? As a result of back pain. And even if you just don't factor in the missed days of work, think of all of the lack of productivity, the lack of effectiveness and efficiency that people have while they are working because they're distracted physically and mentally by their back hurting, right? They can't sit comfortably in their chair. They are unable to travel and do things as efficiently as they could. So it takes longer. They have to continue to get up and move, which, by the way, is a good thing to help you not have back pain. But they have to continue moving, and they can't like get focused on a project that they're doing and like hammer out some work because their back hurts. People are missing a lot of time from work and from the activities that they love to do, even outside of work, because of back pain. And that's not good, you guys. We need to address this. This is a huge problem here in our country and just in the world in general. This number is absolutely crazy. And, I've been this person in the past. I'm sure you have too, or people you know. We have taken medication to change symptoms of our back. I've taken pain pills. I've taken whether that's ibuprofen or Aleve or any one of these things, or whether it's a prescribed medication from the physician's office, taking medication for back pain. We spend $50 billion annually just in pharmaceuticals being used to address back pain as a problem. That is absolutely mind-boggling to me, that stat. It's just crazy. I can't even imagine what $50 billion looks like, right? Let alone $1 billion, but $50 billion only in pharmaceuticals to address back pain. It's absolutely crazy. And the other crazy thing is only a small percentage, less than 1.5% of Americans that are dealing with back pain actually go on to have back surgery. Less than 1.5%. But of those people that do go have back surgery, over the next 12 months, they are the ones that less than 1.5% are responsible for 30% of the healthcare costs related to back pain over the next 12 months. So the ones that have surgery are racking up the most healthcare cost and medical bills to treat back pain, whether that's in medication, whether that's in rehab, whether that's the surgery itself, right? And that's not that surprising because surgery is very, very expensive, and healthcare dollars and stuff have just gotten out of control here in the United States. But we can prevent this by just addressing back pain better from the start, right? We can prevent people going and have surgery. One of the ways that we do that is just by not getting that image in the first place, because only 6% of actual back pain, like back pain cases, are actually due to a true pathoanatomical issue, right? They're due to things like fractures. They're due to things like a tumor in the back or cancer or one of these things that, yes, we do have to have surgery or be immobilized or something. We have to have some significant treatment when those things are present. But the good news is they're not present the vast majority of the time, 94, 95% of the time. That is not what's causing somebody's back pain. And we call those other things non-specific back pain, non-specific low back pain. A lot of times it's mechanical, meaning that the symptoms change as we move. With certain movements, we have pain. With other movements, we don't, or body positions. And for these things, we don't need imaging, right? All of the medical guidelines out there that guide and steer physicians what to do, physical therapists what to do, we call these clinical guidelines, like these papers and these summarizations of research, advocate for less imaging, and imaging not being one of the first steps in addressing somebody's back pain, and for exercise therapy. So when somebody goes to a primary care provider and they get an x-ray, they get an MRI, they get prescribed pain medication, they get told, we need you to rest X, Y, and Z. These are the exact opposite recommendations of what all of our healthcare literature says to do. So then you might be asking, just like I am, well, then why is that what the providers instruct clients to do, instruct their patients to do? And I don't know. I think sometimes the answer is because that's what the patient expects. That's what the patient wants. They have been conditioned and taught by society and by the medical industry that we need the image, we need the MRI to tell us what's going on. That's not in fact true, because again, the vast majority of cases, 94, 95%, there's not actually something structurally wrong with your back that you need the image to direct you in what to do. You should have a clinical assessment first to figure out, do your symptoms in fact match like what is going on? Does your story and how you're describing everything, how does this present clinically? And how do you respond to treatment before we go get that image? Because a lot of times we get the image and then we just have these expectations in our mind like, oh no, I have a bulging disc. I have a herniated disc. Or my favorite, I have a slipped disc. First of all, discs don't slip, you guys. It's not like there's banana peel in your back and Mario steps on it and he slips. We don't have slipped discs. Discs are attached to the vertebrae. They're not slipping and sliding anywhere. Yes, they can get injured, they can get damaged. We can have things like bulges and herniations, but we don't slip discs. Okay, so I mean, I think it would be great if we stop using that term, but one of the reasons we use it is because that's what medical providers tell us. They tell us you've slipped a disc. But when we see these things, On x-rays, we see these, or on images, we see these words like degenerative changes. We see these words like herniation, stenosis. It builds up this fear and anxiety in our mind. And then that, unfortunately, is a contributor. What we think in our mind is a contributor to our symptoms. And that can make our back pain symptoms worse. We can do things like get anxious or catastrophize over the words that we see. And then we get what's called fear avoidance. And then we avoid doing activities that we think are going to cause pain, even if we haven't even done them and we know that it's hurting because we just started to do it. We avoid things just because we anticipate or we expect them to hurt. So then we just stop doing things. And that's one of the reasons that, again, we see that downward staircase kind of effect on a graph of people's activity level gradually declining, declining, declining some more. So what do we do? Like, where do we go from here? We have all these terrible statistics about how impactful and how bad back pain is for us, for as a society. I mean, of course, it's bad for us to feel it. We don't want to have back pain. Well, what do we need to do? First of all, I think if you start having back pain, you need to just take a minute and assess the situation for yourself. Was there an incident? Like, did you fall? Did you get into a car accident? Like, did something actually happen to you that would lead you to believe that there could be a true significant injury to your spine, like a fracture, for example? If so, and then you see a provider and your symptoms dictate, that might be the scenario where an image, an x-ray or an MRI is very appropriate. And maybe you should be the person to go get that. But if you're like so many other people in the typical story that we hear in our office or other providers hear in their offices all the time, and you work on a computer all day, you sit in a car driving for work, you work in sales, or you work at a cash register and you're on your feet all day, and you just start having this increasing, gradual, nagging back pain, or you start feeling back pain and then it turns into these radiating sciatic symptoms down the back of your leg, but you didn't have an incident present. There was not an injury. You weren't playing sports. You didn't crash your bike. You didn't fall. Do you really need to go spend the money and get the radiation of the imaging? Probably not. I would argue in very rare cases, is that image actually going to change from a clinical standpoint, like in physical therapy or chiropractic care or something? Rarely is that image going to change the trajectory of your treatment. Now, what it can do, and this is where we get some of these crazy numbers for healthcare costs, when we get the image early, when we really didn't need it in the first place, what sometimes that starts is this snowball effect, this cascade of increased healthcare spending on things like medications, on things like injections, on things like pain management. And there's a time and a place for all these things. I'm not like putting down these other providers or professionals or anything like that. But most people don't need injections in their back. Most people don't need prescription opioid pain medications. What most people need, quite frankly, is to be taught how to move correctly, to help have that fear and that anxiety of movement and of positions and postures brought down so that they learn that there is no bad posture. If we can get our body into different positions and we can control those positions, that's what we should be striving for, not avoiding certain positions and postures, not avoiding things like deadlifts. And we'll talk on that in a minute. If we can be taught what to do about the issues that are going on, we can be taught how to handle it. And we can address these things without the need for images, surgery, medication, X, Y, and Z, right? But sometimes it depends on what was the entry point that you took into the healthcare system that kicks off this cascade of the trajectory of where you go over the next 12 or 24 months. If you start in urgent care and then you go get an x-ray and then you go see the specialist, it's not surprising to think that that story might lead to surgery or prescriptions or a lack of activity. But if you start with a personal trainer and you tell them you have back pain, or if you start with a physical therapist, or if you start with a good chiropractor, or even a massage therapist, and you start to address things more actively, meaning looking at your movement patterns, looking at your exercise, looking at your sleep, looking at how you manage your stress, and you start doing these other lifestyle factor pieces, we can address this back pain most times without the need for all that other stuff, without the need for the image, without the need for the medication, without the need for stopping playing with your grandkids or stopping going for hikes. We just need to know what we're doing and what we're dealing with, and we need to manage it appropriately, right? This is one of the things that I thought was so cool in the presentation I was watching from ICE, and I 100% agree with this and just absolutely love it. Back pain is a lifestyle problem, not a medical problem, right? Only 6% of the time is it actually a true medical problem, a fracture or cancer or something like that. Back pain is a lifestyle problem. We are not strong enough, not mobile enough, not fit enough to withstand the demands that we're putting on our spines, you guys. No matter what you do, whether you're sitting, whether you're being super active, whether you're sedentary, there is nothing you can do, me, you, anyone else, to get away from forces and stressors on our spine. Twisting, lifting, bending, X, Y, and Z, we do it no matter what. And even if you're super sedentary and you're just sitting around all the time, did you know that sitting places more stress on your lower back than standing does? Did you know that sitting at a computer in a rounded, flexed position puts more stress and shear forces on your back, on your lower back, than deadlifting 155 pounds does with proper form? Right? So when you know these things to be true, you start to realize, oh, well, there's going to be stress on my back anyways. I might as well get it stronger so that I can tolerate the demands of living life, right? Of gravity constantly putting stress on us. I might as well get stronger, because back pain can often be looked at as back not strong enough disease. You guys, our backs are not strong enough to tolerate the things that we're asking them to do, whether that's carrying in your groceries, whether that's picking up your kid or your dog, whether that's simply just sitting at your computer all day long or playing sports or hiking or whatever. You need to have strong enough stability and control around your spine to be able to do these things. And that doesn't happen in the form of imaging and medication and bed rest. We need to move, and we need to move well, and then we need to get strong in those movements, because we lose strength year over year over year after our third decade, right? When we get into our 30s, we just start declining. You guys have probably heard the term, whether it's on this podcast or somewhere else, sarcopenia, the loss of muscle mass as we age. And when we lose strength, we lose resilience. We lose the ability to tolerate the demands of the active life that we want to live. And we need to be able to do those things. And timing is so important, right? We talked about which entry point you use into the medical system or how to address something, but timing is so important too. The sooner somebody starts to address something, when you have back pain, the sooner you get into exercise therapy, whether that's at physio room or anywhere else. I don't really care, right? I care about addressing back pain. The sooner you get into exercise therapy, because again, that's what all the medical guidelines say we need to do to address this problem, the quicker people get better. Now, that could be with physical therapy. That could be lifting in the gym. Sometimes we tell people just go back to the gym, like get back to moving, because the last thing you want to do is lose the strength. Then I want to share some details of this study. So there was a really cool study that was done that helped us to understand and look at what are the characteristics of a person who is most likely to encounter or deal with lower back pain. And what was cool about this study is they looked at subjects, or they looked at people at a variety of different age categories in their life. 16-year-olds, 34, 52. So in different decades of their life. And when they assessed those people, height, weight, activity, X, Y, and Z, they found some very similar findings, no matter which age group or age category these people were in. In those people that had the greatest amount of muscular endurance and strength, those people that had the highest VO2 max, they were in the best cardiovascular fitness. Those with the lowest waist circumference, right? Take a tape measure around the belly button. Those with the lowest waist circumference were the ones that had the best mobility and the fewest cases of low back pain over the period of time that they looked in this study. Right? So the more fit we are, the more active we are, the better shape we're in cardiovascularly and physically from a musculoskeletal standpoint, the less likely we are to deal with back pain. And that shouldn't be a surprise. That's not surprising to anybody, right? But it's hard to do that in our life sometimes. We have life that is set up very lazy for us. It's, I'm sitting in a computer chair recording this podcast. We work in sedentary things. We go to gyms and we walk on treadmills instead of in ellipticals, instead of like going outside and playing, right? We sit in chairs and toilets instead of getting down and up off of the floor. So sometimes it takes a lot of intention to move our body through range of motions that we once had access to, like when you were a kid, for example. And when we do those things on a more and more consistent basis, you're going to be the one that's less likely to deal with back pain. Like, this is what the papers say. This is what the research says, is the more in shape you are, the more mobile you are, the less likely you are to deal with back pain. The stronger you are, the more resilient you are to these other stressors in your life affecting your back from a mechanics and a structural standpoint. So if you're like me and the other 88% of people out there, know that you're going to deal with back pain at some point in your life, but that doesn't have to be like this huge turning point in the story. You're going to come to a fork in the road. And the question is, how are you going to deal with it? Are we going to deal with it by going down the trajectory of the medical system where we get led to things like medication and imaging and surgeries? Hopefully not. Now, if there's an actual true injury present, then maybe that's appropriate, right? That's why we have those tools, but they're just tools. They shouldn't be the only way we address things. Most of us are going to have back pain that's driven by our lifestyle, by a lack of activity or doing too much for what our body was prepared for at the time, right? Capacity and preparedness is very important. How we move and making sure we know how to move correctly. And then when we do, are we strong enough to withstand the demands of the things that we're asking our body to do? Strength is so protective, and it is so linked to longevity and being able to have a great health span, not just lifespan, but health span, like being able to be super active into the later years of your life and have a high level of function despite being older. That's what we talk about with health span. So just know you're going to deal with back pain, but it doesn't have to be this big scary thing because it's very common and we know how to address it, right? We know how to address it. And when we can address it the right way, we can get people back to and surpass the level of activity that they were doing before because we teach them the right things and how to get the right muscles firing at the right time and do the right movements to strengthen and build that resilience. So go address your back pain, right? See a provider that's going to get you doing the right things at the right time. If they think it's very appropriate for you to get an image, they'll tell you that and they'll direct you to that. Especially if you're here in like Colorado, we have access to refer for imaging and things like that. And, we're not going to just like take the chance with people's health. We just don't want to see people getting unnecessary medical procedures done because once you do it, you can't take it back. Once you get that injection, you can't take it away. Once you do that surgery, you can't undo it, right? And if you do try to undo it, it just creates more problems, right? Surgeons don't want to go in and do things again and again and again. So I told you I was going to get up on a soapbox here. I really hope I didn't lose you in this conversation. I hope you see that back pain is a huge problem and we can have a huge impact on people's lives if we just address it right from the get-go. And quite frankly, all these things we're talking about can be used as preventative things for back pain too. So if you get yourself strong and you get yourself in better shape and you lower your waist circumference, and if you have weight to lose, you lose the weight that's unhealthy for you, you are less likely to deal with back pain. Oh, and by the way, all the other things, right? Knee pain, ankle pain, neck pain, shoulder, like whatever. This is pretty much true for all of those, but back pain is the thing that has the most research behind it because it is so damn common. And I don't want it to happen to you, and I don't want it to happen to me again or anyone else. So I appreciate you tuning in, listening to this episode of The Code. I hope you have an awesome, awesome rest of your day, whatever you've got going on. Or if your day is almost over, I hope it was great leading up to this point. What would be great for us and for other people that are, we're trying to get this podcast out to is if you were able to leave us a review. If you've not already done so, scroll to the review section on whatever podcast platform you are listening on or watching on. Drop a 5-star review on there to help us increase that number to 200 and beyond. And we look forward to catching you guys on another episode of The Code. Talk to you later.